Thank you, everyone, for attending today's press conference. This briefing will be hosted by Acting Secretary of Health Keara Klinepeter, Pennsylvania National Guard Major General Mark Schindler, Pennsylvania Emergency Management Agency Director Randy Padfield, and Peter McCouch, VP of Clinical and Quality Outcomes at General Healthcare Resources, to announce a new initiative utilizing skilled nursing facilities to support healthcare workers and provide capacity relief for healthcare systems. Keara?
Great. Good afternoon, everyone. My name is Keara Klinepeter. I'm the current Acting Secretary of Health for the Pennsylvania Department of Health. Thank you for joining us here at the Capitol and online today. To my right is Major General Mark Schindler, Pennsylvania National Guard Adjutant General and Head of the Department of Military and Veterans Affairs. To my left is Randy Padfield, Director of the Pennsylvania Emergency Management Agency. And to my far left is Peter McCouch, the Vice President of Clinical and Quality Outcomes for General Healthcare Resources. Peter is also GHR's Program Manager for this initiative. We're here today to announce the next layer of the Wolf administration's plan to address the crisis our healthcare workers and hospitals are facing due to the volume of patients with COVID-19. Despite recent declines in COVID-19 cases and hospitalizations, there are currently still more than 5,500 people hospitalized here in Pennsylvania. That number may be down from recent weeks, but that volume of patients is pushing hospitals to their capacity limits and straining healthcare workers who are already exhausted from the last 2 years of the pandemic. That's why today we are announcing 4 long-term care regional support sites to relieve pressure on hospitals and skilled nursing facilities, which we refer to as SNFs. Within the next 7 to 10 days, regional support sites will open at the following SNFs: Vincenzient Home in Pittsburgh, Allegheny County, Lutheran Home in Hollidaysburg, Blair County, Springs at the Watermark in Philadelphia, and Clairview Nursing Home and Rehabilitation in Sligo, Clarion County. The Department of Health is continually working with hospitals to evaluate the need and stand up resources to meet the needs for regional support. Each facility will receive clinical and non-clinical staff support to open up to 30 beds to allow for more rapid discharge of patients from hospitals when clinically safe to do so. This will benefit all Pennsylvanians because it will free additional acute care space to meet COVID-19 demands. When hospitals are full, largely due to COVID-19, it could mean care is delayed for people who really need it. General Healthcare Resources will provide clinical staff, including RNs, LPNs, and CNAs, under contract with the Department of Health. The Pennsylvania National Guard service members will serve in non-clinical staffing support roles to help the facility's existing staff, and PEMA will assist in the coordination. We anticipate that these staffing resources will be deployed for approximately 90 days, but the plan will be flexible based on the needs of the community. Establishing these long-term care support sites benefits everyone because it expands the capacity of our hospitals and nursing homes. This is truly a collaborative effort between state agencies and the healthcare community because we're pooling our resources to provide regional support. The long-term care regional support sites are in addition to the state-directed healthcare strike teams currently deployed at Grandview Health in Bucks County, as well as Crozier Health in the Southeast. In addition to these 2 state-directed initiatives, there are federally deployed strike teams in Scranton and York. Their missions have been extended into early March. At the Department of Health, we are in constant communication with hospitals, health systems, and frontline healthcare workers. Our team will continue those meetings to evaluate the success of these initiatives. And now I'd like to ask Major General Schindler to say a few words about the National Guard's important work on this mission. General?
Good afternoon, everyone. Acting Secretary Klinepeter, Director Padfield, thank you for inviting me to participate in today's press conference. Our continued collaboration with your departments demonstrates how government works together as a whole in serving and supporting our communities, especially the residents and staff in long-term care facilities. Our dedicated and well-trained soldiers and airmen deploy in defense of our country. Whether locally, nationally, or globally, our Guard members are always ready, always there. As the second largest National Guard in the country, we serve when needed, where needed, and without delay. Since March of 2020, Pennsylvania National Guard members have played a key role in critical missions supporting the mitigation of the COVID-19 virus. These missions demonstrate the responsiveness and flexibility of our service members who continually step forward and together serve their communities. Today's new mission puts just over 60 Guard personnel split into teams into long-term care facilities where they will actively assist staff who are on the front lines battling the pandemic. Since our long-term care facility mission began in April of 2020, Pennsylvania National Guard has conducted about 180 staffing support missions and provided some form of assistance to more than 160 long-term care facilities. In all, Pennsylvania Guard members have worked more than 16,000 shifts. I'm truly grateful for the continued service and sacrifice of all our soldiers and airmen. I'm equally thankful to their families and employers who support them when they are called to serve. Your support is critical to our mission success. I'd also like to recognize all our first responders and healthcare workers for your unwavering and tireless efforts during these most difficult times. We look forward to continuing our work together in support of the citizens of the Commonwealth. I will now be followed by Director Padfield.
Thank you, General Schindler. I'm pleased to be here today with Acting Secretary Klinepeter, General Schindler, and Peter McCouch from GHR to talk about this new initiative that's much needed. It goes without saying that the COVID-19 pandemic has been and continues to remain a complex public health emergency that has affected about every facet of life. However, the healthcare system has been continuously impacted since the beginning of the pandemic, whether it be in acute or long-term care. Many of the solutions to the wide range of impacts have required collaborative approaches and necessitated leveraging resources and expertise across a broad range of sectors, including public, private, federal, and state, to effectively manage the impacts. The current phase of the pandemic we're in today is no different and no less complex. The National Guard has played and continues to play a critical role in the response to the COVID-19 pandemic. To date, they have supported various missions such as running community-based testing sites, assisting with distribution of food from food banks, medical and logistics staffing and planning support, and supporting vaccination clinics across the state. One of the more significant roles that they have played, along with GHR from the early stages of the pandemic, is providing much-needed staffing support for long-term care facilities across the state when outbreaks occurred that have exceeded the capacity or the capability of the resident staff to deal with them effectively. Today's announcement, as Acting Secretary Klinepeter and General Schindler have indicated, is an expansion of their mission to support skilled nursing facilities across the state and is part of a multi-pronged approach to expand the healthcare capacity to deal with ongoing impacts to the healthcare delivery system after almost 2 years of dealing with the pandemic. This is in addition to other federal resources that we've received and will continue to receive in the near future. All of the support provided by the National Guard and the contracted healthcare staff, such as those provided by General Healthcare Resources, is made possible by the continuing national emergency declaration and ongoing federal public health emergency. Funding for these initiatives is being provided through FEMA and by leveraging the continued use of the National Guard on federal duty status. Our agency works regularly across all levels of government and the public and private sector to lead collaborative planning efforts to respond to complex situations that present unique challenges, such as what we've seen with the ongoing pandemic over the last 2 years. We're pleased to continue to be involved in the planning and execution in this new initiative with the Department of Health, the National Guard, and GHR to address the continuing need of the healthcare system. And now I'd like to turn it over to Peter McCouch from General Healthcare Resources.
Thank you, Director Padfield. Thank you, Acting Secretary Klinepeter. My name is Peter McCouch. I'm the Vice President for Clinical and Quality Outcomes at GHR. GHR greatly appreciates the opportunity that we have to partner with the Commonwealth on this mission. As stated earlier, we have been working with the Commonwealth since June of 2020 in the long-term field range areas. And this acute outreach is another addition to something that we're very, very proud of being able to partner with the Commonwealth on. I'd also like to echo the General's comments and thank our frontline workers, as well as our frontline healthcare workers, including those from GHR, for their tireless efforts and their unwavering care that they've been providing their patients. I'm going to turn this back over to Secretary. Thank you.
Great. So I think, Mark, if you wouldn't mind letting us know who all is next, we're glad to take questions.
Sure. Questions from reporters are going to be given in the order in which they RSVP'd. We're going to alternate between people online on the Zoom call and people here in the media center. First question comes from Paul Go from the Pittsburgh Business Times.
Hi, thanks for holding this and taking the time. How were the regional sites selected? The one here in Pittsburgh, the other three, were they by need by the organization, or were they, did they have open space, or how was that determined? And you said up to 30 people will be able to be transferred there, if I remember correctly?
Sure. So I think I heard all of that question. So the way that we selected the regional support sites was by looking at a variety of pieces of data. So we started looking at the hospitalization rates to understand what the hospitalization rates were in different communities across the state. We looked at hospitals that had a good track record with the department by way of their regulatory compliance, ensuring that there were no outstanding safety concerns at the facilities. Pardon me, and then working with our long-term care team who has good working knowledge of the facility's capacity. Ultimately, it came down to whether they had more licensed beds than staffed beds, so that we would be able to insert the clinical staff as well as the non-clinical staff and to provide this support for the community. And you're correct that this will be up to 30 beds, depending on the facility's footprint and what they're able to accommodate.
In the media center, we have Samantha York with CBS 21.
I just wanted to ask, in terms of focusing on Dauphin County and areas around the capital, could we see any additional support for them? Because I know a lot of the local hospitals have been saying they're experiencing gridlocking too, and they can't have that throughput.
Yeah, so our hope is that, again, we have 2 urban, 2 rural sites that have been established. The closest to the South Central that we're able to establish was in Blair County. And again, this really is intended as a regional resource. And so hospitals in the South Central, such as in Dauphin County, will be able to work with our team, with PIMA, and with the receiving facility to accommodate those transfers.
Our next question comes from Nicole Brambilia.
So sorry, needed to unmute myself. Thanks so much for taking my question. I'm really curious if you foresee that this will be expanded to include counties that perhaps have been missed so far in these regional efforts. And specifically, I'm looking at, obviously, Lancaster County.
So again, I mean, these are intended as regional sites. We are continuing to evaluate what the regional need is based on the current hospitalization rates that are occurring across the Commonwealth. But I think we're very proud that we're able to establish 4 of these, 2 in urban communities, 2 in rural communities. And since this is one part of a multi-pronged effort that we're doing to support our hospitals, we're going to see how this goes and continue to refine the process based on feedback we hear from them, as well as the skilled nursing facilities.
Next up, we have Chelsea Johnson from Fox 43. Is Chelsea here in studio? Okay, we're going to go back to the Zoom. Then we have Jamie Martinez from Spotlight, PA.
Hi, thanks for taking questions. If I could ask a question on another aspect of the pandemic response, participation in the in the state's school-based COVID testing program has increased since the start of the school year, but relatively few public school districts are actually participating to date. What's your message, Acting Secretary, to schools that have not yet signed up, and what's the department doing to get more schools to opt in?
Sure. So, I mean, our recommendation is that as many schools as possible sign up for this free testing program. We continue to collaborate with PDE to increase the number of enrolled school districts as well as the intermediate units. I would also emphasize that testing is one component of how we keep kids safe and in the classroom. That also includes vaccinations. And so we are strongly urging schools and school districts to hold vaccination clinics for kiddos 5 and older, as well as continuing to wear masks, which is, of course, a local decision at this point, but one we feel strongly is important to keeping kiddos safe and in school.
Okay, back in the media center, Tom Lehman from WGAL.
Secretary, earlier today, UPMC's doctors said we are seeing the trend with hospitalizations and new cases come down. Still plenty of cases to worry about.
Sure.
But my question to you is, people who might see that and they might wonder, why are we now pushing this particular initiative into place? Can you address that? And can you also address who exactly is going to be going to these locations? Is it people that would otherwise be in a skilled nursing facility, or is it people who might be headed to one of those places, but maybe not a long-term resident, but just they need that care? Can you just address those two things?
Sure. So from the hospital capacity perspective, I mean, having over 5,500 people hospitalized is still serious. And so while we are starting to see that crest and starting to see that downward trend, 5,500 cases in the hospital is still an acute situation. And so, we've gotten to this point after, if you recall back in December, we asked the federal government for support. We got limited support. And then we've really worked in close collaboration with the hospitals to understand from their perspective what it is we can do to best to support them. And so at this time, our understanding from the hospitals is they would still like us to move forward with this initiative. And I think from a global public health perspective, we still think it's really valuable too. The types of individuals who will go to these facilities are individuals that the hospital and their personal physician or clinician has determined is clinically indicated to no longer be in the hospital, and they do still require skilled nursing facility services. And so there are a number of skilled nursing facilities across the state who don't have sufficient staff to be able to receive new admissions, and that's really who this is intended to support. And so these are individuals who need skilled nursing care, but cannot otherwise find a facility in their community or region that can accept them.
That can be short-term or long-term?
We'll be operating these for up to 90 days, and so our team will be working closely with the receiving support facility to either keep the resident there at the end of this mission or put them in a different facility that best meets their needs.
With the next question is Justine McDaniel from the Philadelphia Inquirer.
Hi, Acting Secretary. Thanks so much. You said each facility will have up to 30 beds. Is there a minimum number of beds they'll have? And why 30? Is that enough to make a significant dent in alleviating the strain, especially if these are intended to be for a whole region?
No minimum. Again, it comes back to what the facility can really accommodate. And we established 30 because that seemed to be a number that many facilities could accommodate and was commensurate with what we were seeing the federal government come out with by way of their strike teams.
Our next question comes from Kate Fishman from The Patch.
Hi, thanks for taking my question. So I was wondering about the out-of-state strike teams, which my coverage area of Bucks has one currently at Grandview Health. I know that these are intended to serve in a temporary capacity of a week to 2 weeks. If there is more need, could a more long-term solution be set up with those strike teams should the hospital have need of it?
Sure. So I'll certainly let Peter speak to some of the specifics of the type of staff that are at Grandview. Those are staff that were deployed by the department as part of our last resort surge support capability. Certainly, if the need arises that after 2 weeks a facility has an ongoing acute crisis, they could certainly reapply for those assets, but really the goal of that is to provide a Band-Aid of sorts for the facility so that they are able to get their own staffing plan in place and at the end of those 2 weeks are able to be self-sufficient. But Peter, glad to have you speak to some of the GHR specifics.
So after some consultation with Grandview, we were able to determine that they needed specific help on night shift. We targeted their medical surgical units and brought in staff, nurses, RNs, to help cover them specifically on night shift to allow them to backfill some of their vacancy related positions. We also have a small deployment of respiratory therapists also working nights at Grandview to support those needs. Some of those nurses have come in from out of state and they have applied for Pennsylvania license. They are licensed in another state. Some of those nurses are working locally in the Philadelphia market and may be picking up additional shifts. So the focus of that mission is definitely different than this mission. The nurses that are coming in for a 60 to 90 day stay in the present 4 partner buildings, those nurses are coming in, they're going to be residing in the Commonwealth, and they're going to be staying for that 60 to 90 day period, covering those additional 30 long-term care beds.
Our next question comes from Dave Wenner from Penn Live.
Thank you. I'm wondering if the fact that there's no facility for the immediate Harrisburg area, I'm wondering if that's because of a lack of a need or a lack of a facility, an available facility that meets the requirements. And I'm also hoping the health secretary can verify the number on hospitalizations, because the 5,500 that she cited, you know, that's a good bit more than the state dashboard is showing right now. I think it's a little less than 4,800. Thank you.
Sure. So again, what we are doing is implementing a multi-pronged regional strategy. So there is a capability that the federal government has deployed at WellSpan York to assist that hospital increase its capacity to help manage the surge in the South Central. We are working to expand that capability as part of our hospital regional decompression sites, and we should have more to share on that soon. And then lastly, we have our SNF decompression capability. And so again, there are a lot of supports that are coming into the South Central, in addition to 1,000 test a day test site that's being stood up at Penn State Milton Hershey. And we do have a SNF support site just outside of the Harrisburg area in Blair County to support that capability as well. And so this is a multi-pronged strategy for what is going to be required to support the hospitals. Again, we are continuously evaluating, and so if we come to find that that approach is not sufficient in supporting the hospitals, we'll pivot and do what is going to work best for them. With respect to the hospitalizations, the 5,500 is the 7-day moving average. And so as you recall, even into last week, we had numbers that were close to 7,000 hospitalized. Again, we've moved to really trying to cite trends as opposed to daily numbers.
Our next question is from Cassie Miller from the Pennsylvania Capital Star.
Good afternoon, Secretary. Thanks for taking questions. My question today is regarding the strike teams. I'm curious if they're fulfilling hospital demand, and has DOH received any feedback from hospitals on how the strike teams are being employed and the success of those missions?
Yes, so we continue to fulfill those requests as they come in. The early feedback that we've gotten from hospitals, I think Peter spoke to Grandview, has been overwhelming gratitude. I think the frontline healthcare workers there in particular who are feeling this acute strain due to the number of individuals hospitalized with COVID are just grateful for the support. The Crozier team touched down on Friday. And I think we are hearing a similar message from them. Again, we evaluate those requests on a rolling basis, and so as they come in, we assess them and deploy resources as they're available. I don't know, Peter, if there's anything else you want to add? Okay, great.
Our next question comes from Julia Zenkevich from WESA.
Hi, Secretary. Thanks for taking questions. I was wondering if you had the exact number on how many beds will be open at the Pittsburgh Region facility.
We don't. So in the coming 7 to 10 days, some of those final details are going to be worked out with the facility. Again, we have landed on these 4 facilities to start. We're also continuing discussions with several other facilities to see if they need to be opened. And I think in about a week, we'll have additional details on, the first residents that are going to start arriving there, how many they will have capability to stand up. But we are planning for around that 30 resident mark.
Next up, we have a follow-up question from Tom Lehman, WGAL.
I know that staffing is a big issue, and I know you mentioned that, but given how long you intend to have these sites set up, is there any concern that the staffing issues that in many cases are preventing these admissions from happening at a lot of these locations won't necessarily be solved? I mean, I'm just wondering if there's we talked about a lot of the institutional problems with healthcare that the pandemic has highlighted, but I'm wondering if there are any concerns long-term that these will help, but then once that 90 days is up, then you've got a problem.
Absolutely. Well, and I think some of this is really what is the role of the department and government. And so I think we're providing these resources to help stem the tide in a truly acute situation. I think a separate matter is how do we long-term recruit and retain high-quality healthcare workers in the Commonwealth? And I think that is an initiative that the department, in collaboration with the governor's office, DCED, L&I, are all working through with input from the healthcare community. But certainly these are intended to be acute short-term fixes, not necessarily to stem, some of those longer-term issues.
On the Zoom, we also have Priscilla Lagoria of WFMZ.
Hi, Secretary. Thank you again for taking all of our questions. For patients being transferred, what specific procedures and types of care can be given at these skilled nursing facilities that don't really need to be done at the hospital?
So different residents need skilled nursing care for different reasons. So every resident that is going to be transferred from the hospital into skilled care is intended to be evaluated to see if they are qualified for skilled care. And that's based on different payers' criteria for what qualifies them. And so happy to follow up if there's a more specific instance or use case that you have a question about, but that really does come down to the specific payer and what they're willing to reimburse for. And I think just, Tom, to go back to your question for a second. So I think the other part that this is really intended to do is as case counts are so high, and not only is the hospital contending with that, but we have more staff outages because staff are out sick, that we're really providing that backbone support. And so even though there are those longer term systemic issues, we also know that if you look at the long-term care epi curve right now, we do have staff infections. And so staff are having to be out for that. And that could be part of why they can't take new admissions. And so this, I think when we get to a state where we just overall have a lower level of community transmission and infectivity in staff, my hope is that the need for a Band-Aid like this, a short-term support like this, won't be as necessary. So I hope that helps.
Okay, we have time for one more question, and I believe we had one more follow-up on the line from LNP News. Nicole.
Thanks so much for the opportunity to ask a second question. Regarding the strike team, since it's a regional approach, how would a hospital that is in the York area, for example, such as Wellspan, LGH, or UPMC Lidditz, how would they go about getting help from the regional strike force in York?
So, and apologies, guys, I know there's a lot of different nomenclature being thrown around, so let me just take a step back for a second, and happy to reiterate kind of what the 3 lines of effort are, and then how a hospital would get somebody into one of the SNF regional support sites. So the first capability that we announced a couple of weeks ago was for short-term staffing to be deployed to hospitals. And so those are the teams that are at Grandview and Crozier Health right now. Those are intended to be there for 7 to 14 days. We can staff physicians, nurses, respiratory therapists, CNAs, and those are able to be submitted from the hospital through the PIMA portal that's online, and then the Department of Health evaluates those requests twice a week, but could evaluate them more frequently if the urgency of the situation called. We then second announced today our SNF regional support sites, and that's where we're announcing four facilities today who can have up to 30 beds each. A hospital will work with the Department of Health and PIMA to say, hey, we have a patient that we need to discharge. We can't find a SNF that can accept new admissions for whatever reason. We think that they may be a candidate to go to this support site. And then the facility and the hospital would get connected, and they would be able to evaluate to make sure that that's the appropriate level of care for the resident. And then third, we have the regional hospital decompression sites. Of course, those were first stood up by the federal government in December. Again, that's less than 30 beds in total that are at Wellspan York and Scranton Regional. And so we are looking at how to expand that capability in order to add more capacity to the hospital. When it comes to a hospital calling one of the hospital decompression sites, that is facilitated through the hospital-to-hospital interaction with the Department of Health's partnership if necessary to make that touch point. So I know there's a lot of different lines of effort and repeated words in there, but hopefully that adds a bit of clarity to the 3 lines of effort and operationally how we're making the transfers happen.
Thank you. And with that summary, that wraps up our news conference for today. Thank you all for attending in person as well as online.